Hey everybody, my name is Megan Galloway. Like Natasha said, I am a certified nurse midwife. And today we are going to be talking about the wonderful and crazy world of sexually transmitted infections, also known as STIs. So little background or maybe some fun facts about why we're talking about STIs. So we call them STIs these days, sexually transmitted infections rather than sexually transmitted diseases for a couple of reasons, but mostly because we're just trying to kind of reduce the stigma around them so that people get tested more frequently and aren't afraid to seek care and treatment. Back to what STIs are, so they can be bacterial infections, they can be viral infections, or they can be parasite infections. And they're passed from person to person during sexual intercourse, which can be vaginal, anal, or oral sex. And they can also be passed along at some point during when a woman is carrying a baby in the womb or during the birth process as well. So we'll talk a little bit more about that later. They are mostly spread by blood or body fluids, but can be spread by skin to skin contact, and semen can be present to spread them, and sometimes is not necessary to spread them. And they're often curable, which is great. So they are, if you treat them early enough, then you are likely to be able to cure these STIs. But the problem is a lot of people don't get tested and therefore don't get treated. And then if left untreated, these things can turn into pretty bad health complications at times. So that's one of the reasons we're talking about this today, just to encourage people to get tested. Next up, the reason we are talking about this today is because it is a public health crisis. Some fun statistic for you, syphilis has increased by 80% in the past 6 years alone. And newborns that are born with syphilis, which is called congenital syphilis, saw a tenfold increase from 2012 to 2022. So over 10 years, it increased by 10%, or 10 times. Almost, this is a fun thing most people don't know, almost every single man and woman, by the time they reach the age where they pass away, will have contracted some form of the HPV virus. And as far as the herpes virus goes, 80% of us actually carry that virus in our blood in one form or another. The HPV vaccine, which we'll talk about in a bit, is the only vaccine available on the market that can actually prevent cancer, which is cool. And it is now recommended for ages 9 to 45, whereas it used to have a cutoff age of 26. So a lot of people now can get it as they're older rather than having to not be able to get it after the age of 26. All right, so what are the STIs we're going to be talking about today? We will talk about the most common forms that are out there. There are a few others that we won't talk about, but chlamydia, we'll talk about gonorrhea. Most of you have heard of those. Trichomoniasis is a fun word. We lovingly call it trick in our world, and that is another one we'll talk about. Herpes, everybody's heard about. We'll go into some good detail about that one. I think it's one that people are pretty have a lot of questions about. And then human papillomavirus, which is that HPV that I spoke about a little bit ago. We'll talk about syphilis, and then we'll briefly go over HIV, AIDS, hepatitis B, and hepatitis C, as those aren't quite as prevalent. We're going to talk about all these things. We're going to talk about how they're contracted, what their symptoms are, if any, and how they're treated. So let's get into the first one, chlamydia. Chlamydia is the most commonly diagnosed STI in the United States, and it is a bacterial infection, and it can be transmitted through any of the forms of sex, so vaginal, anal, or oral sex, and semen does not have to be present to be able to transmit chlamydia. So what are the symptoms? First of all, mostly chlamydia doesn't have symptoms. So a lot of people don't think they need to get tested because they're not having symptoms of STIs, and that's simply not true. But if you are going to have symptoms, if you're a woman, you may have some vaginal discharge, and that's just kind of mild. If left untreated, you could get a very severe pelvic infection, and that could even lead to ectopic pregnancy, which is a tubal pregnancy. For men, you may get some penile discharge and you may get pain or swelling in your testicles. Both males and females can have burning with urination. You can have rectal pain. You can have rectal discharge or bleeding. And eventually, if left untreated, these things, chlamydia can cause infertility for both men and women. Fun fact, oral chlamydia doesn't often have symptoms, but you can contract it orally. So if you have been potentially exposed orally through oral sex, then you do need to get an oral swab, which we'll go into next. How do we test for it and how do we treat it? So testing should not be done immediately if you have a known exposure to chlamydia. It can take up to 2 weeks for a test to come back positive. So make sure that you don't go next day to get it tested because it probably won't come back positive. Usually we can test it as easy as a urine sample for men or women, and we can also do swabs, so vaginal, penile, anal, or oral swabs depending on which type of sexual contact you've had. We can also test for it on a pap smear, so I always offer it when I'm doing a pap smear for women. Treatment, good news, it is curable. Because it's a bacteria, we can just treat it with antibiotics. You do want to make sure your partner is treated, and so a lot of us providers will offer to treat partners without their partners having to be tested. However, some people do recommend that your partner goes and gets tested and then gets their own prescription for antibiotics. However, you want to make sure that both parties are tested or at least treated, and you should wait 7 days after the last partner gets treated in order to have any form of intercourse again. So that just makes sure that the antibiotics have kicked in, have killed that bacteria, and you are good to have intercourse again. With chlamydia, the antibiotics, as long as you take them correctly and you avoid intercourse afterwards, are very effective, and we don't necessarily need you to come back to be retested. However, some people do choose to do that to make sure the bacteria is gone. All right. Next up, we'll talk about gonorrhea. Gonorrhea is one of the other, I guess, second most commonly diagnosed infections for STIs in the United States. It is also a bacteria, and it is very, very similar to chlamydia, but it does have a few differences. So it's transmitted the same way through all the different forms of intercourse. And symptoms are pretty similar, but they do have a couple of differences. So with women, you might get vaginal discharge again. But one of the things that's different about gonorrhea is it can cause bleeding in between periods. For men, you get the same type of discharge or pain or swelling in the testicles. And then the other thing that gonorrhea does that's different than chlamydia is it can cause some rectal pain, it can cause rectal itching, rectal discharge, or rectal bleeding, and that those are kind of the differences. But otherwise, similar symptoms, and we usually test for both gonorrhea and chlamydia at the same time whenever we're testing for these STIs. Just so you guys know, gonorrhea can be transmitted during the birth process. And so babies who are born to mamas who have gonorrhea can actually get blindness, but we do treat all babies with an eye ointment, an antibiotic eye ointment at birth to get rid of that and prevent them from getting blind from it. So testing and treatment, again, you want to wait 2 weeks after an exposure in order to get tested. It's the same testing as chlamydia through urine, through a swab, or on a pap smear. And it is also curable, which is great. It is treated with antibiotics. The trouble is usually it requires an injection of antibiotics. And so it is something that we can't really send in a prescription for your partner. So your partner does need to go and get treatment. Again, you want to avoid sex for 7 days post-treatment. And for this one as well, you don't need to be retested necessarily unless you want to. Okay, I told you we'd go over the fun word, trichomoniasis. It is a little different than gonorrhea and chlamydia. It is a parasite, which looks very much like the image you see on the screen. It's actually kind of fun to look at under a microscope, even though that's maybe a little weird. It can be only a vaginal or penile infection. It is not transmitted orally or rectally, which is great. So just vaginal intercourse can transmit this. But it does have a really high rate of recurrence. And so we'll talk about that when we get to treatment, but that is something that we see sometimes people getting trich over and over and over again. The symptoms, fairly similar to gonorrhea and chlamydia. You can have some, for women, vaginal itching and burning, soreness of the vagina or the vulva, and potentially pain during intercourse. For men, you make it like an itching in feeling inside the penis, and then potentially burning after ejaculation. For both parties, again, often asymptomatic. People can have trichomoniasis for years and have no idea. And it's honestly one we don't test for that frequently, but definitely if you're thinking you might have this, make sure to ask for this test specifically because it's not always standard alongside gonorrhea and chlamydia testing. Both people can get burning with urination and can get abnormal discharge. It does, if you have trich, increase the likelihood of you getting HIV from an infected partner. It can cause preterm birth, and people, like I said, can live with it for years, which we already went over. The testing and treatment, so it's a little bit different of a time frame to wait before you get treated. So if your partner or if you had a known exposure to trich, then it can take at least a week to get back a positive result, but often can take up to a month to get a positive result after after an encounter. And it's only done really with swabs. You can't take it off of urine. So either a vaginal or penile swab. And we can do it off the pap smear, although pap smears are not usually quite as accurate at diagnosing trich. It is also curable. It is treated with anti-parasitic medication, which is usually oral. We can usually send that in for your partner as well because partners should be treated as well. You, again, want to avoid sex for 7 days afterwards. And this one is really important to retest for at 3 months after you've been treated because of that high rate of recurrence. All right, herpes. This one's a long one. Drink my water here to prepare. So herpes, everybody's heard of, and it is a viral infection. It is composed of 2 viruses. There's HSV1 and there's HSV2. HSV1 can either be oral, like cold sores, or it can be genital lesions. And HSV2 is genital lesions. It is contracted by direct contact with a lesion, and that's either with a cold sore or with genital herpes. It is a weird virus. It is going to either be dormant or it is going to be active. So it's going to be sleeping or it's going to be awake. When it is sleeping dormant, it does not cause problems. You're not going to get a cold sore. You're not going to pass along your cold sore to anybody. Same thing with genital lesions. But if it's active, you're going to get lesions, and then that's when you can transmit it to other people. I think one of the most important things to tell people about herpes is that if you come up with a new diagnosis of genital herpes, it is not necessarily contracted from your current partner. So people can have been exposed to the herpes virus years and years and years ago and never have had an outbreak, and then have their first outbreak when they have a new partner. And so that virus can live in your system for a long time without having an outbreak. And in fact, many people never have outbreaks, even though they might have that virus in their system because they have been exposed to it in the past. So with that being said, when I diagnose someone with herpes, I think the first thing that gets in their mind is, oh my gosh, my partner cheated. Oh my gosh, I got it from my partner. And that's just not how the virus works. So maybe check your reaction if you do get diagnosed with herpes, and because it could have come, you could have been exposed a long, long time ago from it. There are differences in how the viruses react. With genital herpes, if it's HSV1, it has a recurrence rate of like maybe once every 1 to 2 years. And HSV2 has a recurrence rate of like 4 to 6 times per year. HSV1, as a cold sore, we don't consider a sexually transmitted infection, but as a genital lesion, we do. But through oral sex practices, we can transmit HSV1 from cold sores to HSV1 on the genitals. The virus number doesn't change, the location just changes. So just be careful if you do have a history of cold sores. with oral sex, you want to be careful if you have an active cold sore not to have oral sex, to give oral sex, because then you could transmit it to the genitals, and then it does become an STI, and that for a lot of people is much more difficult to deal with, at least emotionally. All right, so what are the symptoms of herpes? We talked about it: cold sores and genital lesions. The picture in the last slide was kind of what those genital lesions look like. There is a difference between a typical primary outbreak, which is a first-time outbreak for a genital lesion, and a recurrent outbreak. So your primary outbreak typically is fairly terrible. It can last for quite a long time, up to like 10 to 20 days. And it usually comes with several very painful blister-like lesions on your genitals somewhere. It can also be inside the vagina for women. And so you can get not only these lesions, but also swelling of the genitals. You can get swollen lymph nodes. You can get fever, chills, body aches, feel like you have the flu. Some people have tailbone pain, or it like radiates down their leg. And some people feel like they have a UTI because of the way that the virus works, kind of infecting that whole area, those nerves. So the primary outbreak is hard to miss. So even if you are a person who has carried HSV1 or HSV2 in your bloodstream for a long period of time, and you're wondering, oh my gosh, what if I've had an outbreak in the past? A primary outbreak's really difficult to miss for the most part. Most people have a significant outbreak, and they know when it's happened. There are outliers to that, of course, but that's typically what it presents as. With recurrent outbreaks, you're going to get maybe 1 to 3 little lesions in usually the same general area as where you had your initial outbreak, and it usually lasts for just a few days. So it doesn't come along with any of those other symptoms, but they're painful and maybe a little itchy and burny and things like that. There's also something called a prodrome, which is how we know that we might be getting an outbreak. So there's this thing called asymptomatic shedding, which is basically where you don't have symptoms yet and or ever, and the virus can spread. And then there's a prodrome, which is where you have symptoms that you know are going to lead to getting an active lesion. So they might be like, it kind of tingles in the area, it burns a little in the area, it itches a little in the area, and then, a day or two later you get a lesion. So with asymptomatic shedding, that may never turn into a lesion. Unfortunately, that's why the virus is so prevalent, is because it can spread even at times when there's no active lesions. So the virus becomes active but doesn't actually have a lesion associated with it. So both with prodrome, which is the leading up to an active lesion, and asymptomatic shedding, when there's no symptoms whatsoever, the virus can spread. So that's the annoying thing about herpes is, we know it spreads when we have active lesions, but we don't know it's spreading when it's just asymptomatically doing it. And that doesn't happen all the time, but it definitely can happen. And so the next slide is going to talk about testing and treatment. So when we test for it, we do want to make sure we're swabbing those lesions. So if you think you could have herpes, it's really, really important to be seen fairly quickly, because if you're not and that lesion heals up, then we can't really determine whether or not it was herpes or something else going on. So make sure to get in to somewhere, urgent care or your doctor's office, to get a swab of that lesion to test whether it's herpes or not. And when they do swab that, they can tell you whether it's HSV1 or HSV2, which can be helpful information for you and your partner. There is blood work that can tell you whether or not you have antibodies to the herpes virus. Basically, all this blood work does is tell us whether or not you've been exposed to the herpes virus in the past. So it can tell you if you have antibodies to HSV1, HSV2, or both. For you clinicians out there, these days it's pretty much only IgG, which for you lay people just means it's like showing kind of a past exposure. We don't really do IgM, which is a more recent exposure testing on herpes, because they found that it wasn't super beneficial and helpful in determining whether somebody's had a recent outbreak or not. So we also can't, with the antibody testing or with any of the testing, tell you whether this was your first outbreak or whether it was a recurrent one. I always tell people, do not get the blood work done unless there is a really good reason to do it. So when people come in and ask me, hey, I want HIV, syphilis testing, I want all the blood work for STIs, I tell them I'm not testing you for herpes in your blood, because as we said in one of the first slides, 80% of us carry that virus. So 67% of us carry HSV1 in our blood, and 13% of us carry HSV2 in our blood. What that means is we've been exposed at some point, but it doesn't mean we're ever going to have an outbreak. So with that being said, in that little treatment section over there, antibodies, positive antibodies does not equal positive disease. If you have the positive antibodies to herpes because you've been exposed to at some point, that does not mean that you have herpes. If you've never had a cold sore and you've never had a genital lesion, you do not have herpes, okay? You just have the antibodies, just like all of us know about COVID antibodies, right? So you got exposed to it at some point and your blood work mounted an immune response to that, but that does not mean you have active disease, okay? With that being said, the antibody testing can be helpful when we're talking about our partners. So say you get a genital lesion and it is HSV1, and your partner has never had a cold sore or a genital lesion, but they want to see if they have antibodies. So partners can go get blood work to see if they have antibodies to HSV1. And if they do, it's next to impossible for you to pass along HSV1 to your partner because they've already mounted an immune response to that. So it's very unlikely that you're going to give genital herpes to your partner if you both carry the same antibodies, because your partner's antibodies will protect them against new exposures to that virus. So that's really the only time I think that antibody testing, blood work for herpes, can actually be helpful. But, up to you. If you really want us to do it, we'll do it. I just find it to be a very, very confusing blood test, and people don't usually know what to do with it if they get a positive result, and it just makes people upset most of the time. So herpes isn't curable. It's going to be with you forever and ever and ever, which is real unfortunate, but it is very manageable for most people. So we do have medications that can treat herpes. So for any sort of outbreak, either cold sores or genital lesions, you're going to take an antiviral medication, and that is not going to kill the virus, but it will decrease the length of symptoms and the severity of symptoms. It is given for a genital outbreak, the first one, usually for 10 to 20 days. And for a recurrent outbreak, you really only need to take it about 3 days before most of the time those lesions are gone. It's really important that you want to take these medications ASAP when you first have an outbreak, or when you're getting that prodrome. If you're feeling like you're getting an outbreak, go ahead and start taking your medication if you've already been diagnosed. And that way your symptoms will be much shorter. We also use this medication for what we call suppression. So for some people who have herpes, they talk with their providers about suppressing that virus so that they can't transmit it to their partners. And that means taking these antiviral medications daily in order to try to keep that virus at bay so they don't have an outbreak. It's really only studied well in HSV2, which is good because HSV2 has the recurrence rate of 4 to 6 times per year, and that's the genital lesion only virus. But you could try it for HSV1 if you really feel strongly about that. It just doesn't have a lot of data to support doing it for HSV1. So sometimes that helps make it manageable for people so that they feel safer having sexual contact with their partners. All right, that is the end of herpes. Let's go along to HPV, which is human papillomavirus. HPV, fun fact for you, is the most common STI out there. the most common. There are over 150 strains. And like I said in the beginning, almost all of us will have been exposed to at least one of those strains throughout our lifetime. It is caused by either sexual activity or by skin-to-skin contact. And we'll get into kind of those two things here in a second. So symptoms of HPV. Genital warts can be spread by skin-to-skin contact, and that's really the only one that is skin-to-skin contact other than sexual activity. And then otherwise, HPV doesn't have any symptoms when it's just HPV. Now, HPV can cause multiple forms of cancer, and so if it does lead to cancer, then you may get some symptoms of that cancer. The most common one that we're checking for is cervical cancer, and I think that's what most people know about, is that we check for HPV when we're doing pap smears on women, as long as they're over 30 for the most part. And if you have HPV, then you have a higher risk of having cervical cancer. So cervical cancer, you might get bleeding from the cervix. It can also cause vulvar cancer, which may have some lesions on your vulva as a lady. Penile cancer, you may have lesions on your penis. Anal cancer, and then it can cause throat cancer as well through oral sex, and so you may get throat lesions. So I think that's important to give that information out, because I think that women know about HPV because we get pap smears, but men have not a lot of idea about HPV most of the time, and that's because they don't get pap smears. So men don't actually get tested for it, which is kind of unfortunate because men can get penile, anal, and throat cancer from it, but there's no screening test for men. And that is a big reason why it is so easily spread, is because it doesn't have symptoms. There are over 150 strains, and we are testing women for it, but only like every 3 years or so. And men were never testing for it. So it's just being spread back and forth like wildfire. So testing for it for women looks like a pap smear. In the United States these days, most guidelines suggest starting pap smears at age 21 for women. So for those of you out there who got your first pap smear when you were 15 years old because you started birth control, that is no longer the recommendation. Regardless of birth control status or sexual activity status, we do not start pap smears on women until the age of 21. And there's even some information out there that might have us started at age 25 in the future. So that would be cool. It is now, pap smears are recommended every 3 to 5 years if you've had a history of normal paps. And that is also a change. It used to be yearly. So that is always a positive for most women. Get excited about that. Pap smears are checking for a couple things. For the most part, they're checking for abnormal cells on the cervix that could be precancerous, and then they're looking at HPV in some cases. What they do is they allow us to treat those abnormal cells before they turn into cervical cancer, which is wonderful. So that's why we encourage people to get routine pap smears and to follow up at the recommended increments that are recommended by your provider. So treatment, HPV is not curable, and the only treatment available is if we are doing procedures on women's cervixes to prevent them from turning into cervical cancer. But it is a preventable thing. And so with that being said, we like to talk to people about the Gardasil vaccine. For those of you with kids out there, a lot of them are getting it around age 11 or 12, and it prevents against not all 150 strains, but it prevents against the most dangerous strains, the ones that are most likely to cause cervical cancer or all those other cancers out there. It is recommended for both males and females, so starting at age 9 up to age 45, like we talked about. And we really encourage you to get it for your kids before they start having sexual activity so that they prevent getting HPV that could turn into cancer, because once you get it, the HPV vaccine is not going to prevent against that strain anymore. With that being said, I still recommend it to all my patients who, regardless of their marital or monogamous status in their relationship. because of the way HPV works, it's really basically the same thing as the herpes virus in the way that it works. So it's either dormant or it's active. And when it's dormant, it does nothing to us. You can't pass it along to anyone, and it doesn't cause harm. When it's active, that's when it can cause harm and when you can pass it along to someone. With that being said, we're never going to know when it's dormant or active because it doesn't have symptoms unless you have genital warts. So with HPV, we want to make sure that everyone is getting that vaccine if they want it, regardless of their relational status. Because say if your partner ever had a sexual partner before you, they could still be carrying a strain of HPV that you have yet to be exposed to because it's just been dormant this whole time. Both HPV and herpes tend to be more active when you're in times of stress, when your immune system is low. Smoking actually causes a lot more HPV to be activated in people's bodies. So if you're a smoker, we really encourage people to stop smoking. I mean, we do that anyways, but just another good reason out there for you. So you can get it up to age 45. You can really get it anytime. If you want to pay for it out of pocket after the age of 45, you can absolutely do that. It's really just that insurance only pays for it up to the age of 45 these days. All right, syphilis. This is one that is super important to talk about. And also, I think pretty much nobody knows anything about it. And we've just heard of it and we hear about it in all of our old books about the Wild Wild West, but we don't hear about it these days much anymore. But like I said in the early part of this presentation, there's been an 80% increase in cases. And so it is on the rise, which is just kind of crazy to me. So we'll talk about it. It is a bacterial infection, which means that when we get to the treatment part, it's again antibiotics that we use to treat it. Congenital syphilis, which is where babies get syphilis from their moms in the womb, and has actually risen by 31% just from 2021 to 2022, which is when they did the most recent STI data collection. And besides during the pregnancy, it can be transmitted normally through vaginal, oral, or anal sex. So what does syphilis look like? So there are 4 stages of syphilis, and it looks different in each stage. The only good thing about syphilis is that the initial stages do have symptoms, so it might trigger people to go get tested. So stage 1, you're going to have firm, round, painless sores in areas where the disease entered your body. So it might be around your lips, around your vagina, penis, anus, that kind of thing. The sores are usually pretty small, and so they're difficult to notice for some people because they're not painful, and they're going to resolve independently. Then eventually it might go into stage 2, where you're going to have a rash and open sores, and it's kind of like what we saw in the picture there. It can be in the same areas where you contracted the virus and the same areas where the other sores were, but it also can be on the palms of your hands or the soles of your feet. You may also get fever, muscle aches, headaches, weight loss, swollen lymph nodes, fatigue, flu-like symptoms, essentially. And then again, this one is going to resolve independently. So just because these stages resolve on their own does not mean the bacteria is gone. You then go into stage 3, which is the latent stage, which just means it is still present in your body and still able to be passed along and still able to cause damage, but it has no symptoms. This latent stage can last for several years, and eventually it may turn into stage 4. It doesn't always, but may turn into stage 4, which can occur like 10 to 30 years down the road after you've contracted the disease. And this is when it causes all kinds of organ damage, and it can even lead to death, which is unfortunate. So make sure to get tested. Testing is easy. It's a blood test, and it's going to be positive by 1 to 3 months after an exposure. So if you've had unprotected intercourse and you're wanting just routine STI testing, if you do it, within 1 month great, then that's probably going to be catch most cases, but by 3 months, it's going to catch pretty much every case of syphilis. You do want to make sure your partner gets tested if you get diagnosed with syphilis, but most of the time, if you have syphilis, your partner is going to have syphilis. And so we just pretty much treat everybody. In pregnancy, we do test for syphilis. We typically test in the first trimester, every single pregnant person. And there are now recommendations out there where we test a lot in the third trimester, and some places are even testing when a woman goes in to have her baby, because congenital syphilis is so dangerous. If babies contract syphilis in the womb, they can get severe organ damage and it can cause stillbirth as well. So super, super important to know that you have it and be able to treat you for it to be able to protect your baby. Syphilis is curable, but the organ damage, if you wait too late, is likely not reversible. So getting tested early and tested often is super important. You want to treat with antibiotics. It's a pretty easy treatment, and you want to make sure your partner is treated as well. And of course, abstain from intercourse during treatment. Just because you've treated syphilis once and you've had it once does not mean you can't get it again. So make sure that if you have risky sexual behaviors, risky sexual partners, and you could have contracted syphilis again, you want to make sure that you get tested for any time you think you could have been exposed to syphilis. All right, moving on to AIDS, HIV really, and then AIDS. So syphilis actually puts you at higher risk for contracting HIV and AIDS. And HIV, human immunodeficiency virus, is a virus that attacks the immune system. And rates in the US are actually declining, which is wonderful. They were down 12% from 2018 to 2022. And that's for a lot of reasons. We've just learned a whole lot more about HIV and how to protect against it. And we've come up with a lot of medications out there that can keep the virus suppressed so that you can't transmit it to other people, and and you can also take medication that keeps you from acquiring the virus from a partner. It is spread through blood and body fluids, and is also spread through breast milk. So when I talk about testing for HIV and syphilis and the next two, the hepatitises, I talk about risky sexual partners and risky sexual practices. I don't think everybody always needs to get tested for these things, but definitely if you fall into categories with these two risky behaviors, then you should get tested regularly. So risky sexual partners can be partners who are sex workers, partners who've been IV drug users, people who've been in jail, and then risky sexual behaviors, having sex with multiple partners, or men who have sex with men. And you just want to make sure that if you have any of these behaviors, you're getting tested. HIV does progress to AIDS if it is left untreated, and survival rate after you develop AIDS is approximately 3 years. HIV mostly doesn't have symptoms, may have mouth sores, swollen lymph nodes, rash, flu-like symptoms, and these typically occur 2 to 4 weeks after you have an exposure to HIV, and they last anywhere from a few days to a few weeks. HIV can turn into a chronic form, which can just last for years without having symptoms. But during that time, the virus replicates, so it builds and builds and builds on itself. And as it builds and builds, the higher the amount of virus we call a viral load, the higher that viral load is in your system, in your bloodstream, the more likely you are to pass it along to someone else, and the more likely you are to have it turn into AIDS. So AIDS is a severe form of HIV, and it leads to a very, very damaged immune system, which can lead to many, many severe illnesses and eventually then leads to death. So testing and treatment. Testing is done with a blood test at a healthcare facility. They also have home tests these days. So you can do a little finger prick and test for HIV, which is pretty cool. So that gives a lot of people access for testing partners before they have intercourse, or testing themselves if they've had an exposure. You want to wait 2 to 6 weeks from an exposure to do these home tests before it would come back positive. So if you want to give it a good grace period, make sure to wait at least 6 weeks after you think you have been exposed. Treatment, it's not curable, but it is much more livable these days. HIV used to be a death sentence. It would always lead to AIDS, but now we have medication that reduces those viral loads, the amount of virus in your system, to the point where transmission is next to impossible, and to the point where it significantly reduces your risk of it turning into AIDS. There are 2 medications out there. We're not going to go deeply into these. The first one is called PrEP, which is pre-exposure prophylaxis. So if you know that you might be having sexual activity with a risky partner or risky partners, you can be taking this pre-exposure prophylaxis daily to reduce the risk of you contracting HIV. And then there's post-exposure prophylaxis, which is a medication you can use if you think you were exposed to HIV, and it will help keep you from actually getting that virus. Okay, lastly, the last 2 are going to be hepatitis B and C. I put them on the same slides because they're essentially the same thing, but they have a couple of differences. So they are both viruses that affect the liver, and they can both cause really serious liver disease, liver cancer, and death. They are spread through blood and body fluids, and they can be transmitted through birth and breastfeeding. So hepatitis B specifically can be spread through body fluids, whereas hepatitis C is only through blood. And hepatitis B is also given through breast milk for some, and through the birth process. But hepatitis C is really only through the birth process because it's just blood. It's not going to be transmitted through the breast milk. Hepatitis C is super, super common among IV drug users from sharing needles. So if you are an IV drug user or have had sexual contact with somebody who is, that would be a good time to get tested for hepatitis C and B for that matter. The symptoms are the same for both, but sometimes they don't have symptoms. And if they do, you're maybe going to get dark urine, clay-colored stools, be super tired, have a fever, joint pain, loss of appetite, nausea, stomach pain, vomiting, and then eventually can turn into yellow eyes and yellow skin, which is a sign of jaundice when your liver is severely affected. Testing and treatment. So hepatitis B is not curable, but there is a vaccine available to it. In fact, it's one that we give to newborns, usually about an hour after birth, and is a series of 3 shots. So most kids are protected from it if you choose to give your kiddos vaccines. And it is tested via a blood sample, and it takes about 3 to 6 weeks after an exposure before you're going to get a positive result. Babies who are born to positive hepatitis B mothers are going to be recommended to get the hepatitis B vaccine right after birth, which is what we recommend for every baby anyways. And then there's something called the hepatitis B immune globulin, which is going to help protect them from getting hepatitis B through the birth process. Hepatitis C is curable for the most part. 95% of people can be cured from hepatitis C, which is great. It is tested for via a blood sample, and it's about a 2 to 6 month wait before you would get a positive result after an exposure. There is no vaccine available for hepatitis C, but the good news is mostly curable. Babies who are born to positive hepatitis C mothers should get tested directly after birth. But again, there's not a vaccine that we give those babies right after birth. Okay, that is the last of it. So almost all the information that I got in this presentation was from the CDC website. So if you are curious about STIs, the CDC has pages and pages of facts and statistics and information about testing and treatment and all the things on their website. So I didn't make a reference page because it's pretty much all there. The timetables for you clinicians out there, this is a really helpful link that I used for my presentation that tells you when things can be can come back positive. So when I gave you like, hey, you should wait 2 weeks to be tested for chlamydia, this little link next is a great timetable from the University of Oregon to tell you when things will come back positive. The video is going to be on Barton Health's YouTube channel. So if you need to refresh your memory or you want to share this with a high school class or whatever, feel free to go to Barton Health's YouTube channel. You can find it there. And then I actually have a YouTube channel too, and I've done several videos that are incremental about these STIs. And so if you want to learn more in quick blurbs or present quick blurbs about herpes or gonorrhea and chlamydia and things like that, you can find them kind of broken up on my YouTube channel, which is Women's Mindset, and the link is right there. Oh, look at me, right at 45 minutes. Time for questions.
Awesome. That was wonderful. Thank you so much, Megan. Just as a reminder for attendees, if you have a question, you can ask it in the Q&A box located at the bottom of your Zoom screen. There is even an anonymous option if you want to ask that way. And while I wait for questions, I thought maybe you could just explain quickly what you do in your role and what sort of patient expertise, because I think it's important to let people know.
Yeah, so like I said in the beginning, and like Natasha said, I'm a certified nurse midwife. And I think when people hear that, they think, oh, you do home births and you only work with pregnant people. And that's not true. So I do work with pregnant people. I also deliver babies. Currently, I am working at Barton Health and deliver babies here in the hospital. And as a clinician in the office, I not only do prenatal care and aftercare for moms who had babies, but I also do the full gamut of women's health care. And so STIs are a very routine part of my day, testing for them, treating for them, and a lot of other women's health problems, birth control and menopause and all that other fun stuff. So that is part of the nurse midwife's role, and we are just part of the women's health team.
Great. A question that came in, why do we wait to give the HPV vaccine, considering the benefits? Is it something that can eventually be given to infants like some of the others?
That is a great question, and I don't know the answer to that. My guess is that it just hasn't been studied in kiddos less than 9 years old, but it's something that I would be happy to ask our Gardasil representative about, and it might even be in we have pamphlets about Gardasil here. It might be in there, but I think it's just they've studied it. They originally studied it between ages of 9 and 26, and now they've studied it up to age 45, and so that's why insurance is covering it up to that age. But I don't really know the answer to that. And I'm happy to, if you want to, leave information or do something like that, I'm happy to look it up for you and let you know. But I think it's because it hasn't been studied that early.
Great. Another question for those of us with teenagers or young adults, what's the best message to give them to stay safe, especially from STIs?
Yeah, great question. I think, well, I am not a parent, but I work with teenagers here all the time. And I love when parents have been talking to their teens about STIs and pregnancy prevention and things like that. I think the most important thing is have the conversation and have it probably earlier than you think you should, because teens are having sexual exploration sooner than a lot of us expect them to. And so if they don't know what the risks are, then they're not going to be safe. Most importantly, use protection. Have some condoms around. Give your teen some condoms if you're comfortable with that. And then if you want to talk to your teen, if you have a daughter and you'd like to put her on some sort of birth control or talk to her about birth control, I think that's really important. I think, one of the things I've learned when I have teens that come in here is most of them don't come in and talk to me about birth control until they've already started having sex. And most of them, when I ask them, do you use condoms? They say, yeah. And then I say every time, and they say, eh. So they're not being as safe as they can, I think because they maybe don't have the access to, they don't have condoms on hand, but they were exploring or whatever else. So I think talking early and often, providing condoms, and talking to your teens about both STIs and pregnancy prevention is super, super important, because the more you can have that conversation and be a part of that with them, even if it's super uncomfortable, I think the more they feel comfortable seeking care, getting tested, and coming into the clinic. And just for people here in California, kiddos ages 12 and up are considered confidential minors, 12 to 18, and they can actually come and see me without parental permission to get STI testing and get birth control and things like that, which I think is a really helpful thing in California, because sometimes teens don't always feel comfortable talking to their parents, but they want to be safe, they want to be responsible, and so we do offer confidential visits for teens here at Barton, and I think that can be really helpful for them as well.
Great. You actually answered the next, if not last question, just regarding how kids can access care. Do you want to just maybe mention, I don't know, and I'm sorry, Megan, to put you on the spot, I can put it in the chat, but if you know the office line, or just let them know to call.
Yes. I have it. I don't have it memorized, but I can see it on my phone. It's 530-543-5711. And that will get you here to the South Lake office for the Barton OBGYN clinic. There, we also have an office in Minden, Nevada, and people, depending on insurance, can be seen either place.
Great. I'm going to put that, let's see if I can put it quickly in the chat, just so everyone has that phone number. I think that's a really good reminder to parents that kids can access confidential care through either Barton OBGYN or the Community Health Center. With that, I'll keep an eye for any last questions, but I'll start to wrap it up. As Megan mentioned, this was recorded and will be available on our YouTube channel. I'll also put it up on our Facebook page if that's an easier spot to find it. And then at the conclusion of this webinar, you will receive a survey, and we'd love your feedback, how we did tonight, and then future topics you'd like to hear from us. It's super helpful. But I don't see any other questions, and I think we'll go ahead and give everyone 7 minutes back, and you've gotten some great feedback in the chat. So thank you, Megan, so much. Thank you, everyone, for being here. Enjoy the rest of your nice summer evening.
Thanks, everybody.